And now we want to talk to you a little bit about chemical inductions, specifically Pitocin. That's the most used form of chemical induction.
Well, so the interesting thing about Pitocin is that it is it's actually just a synthetic mimic of your own oxytocin. So actually, the bag, it's always administered via IV. So if you ever have Pitocin, it will actually say oxytocin on the bag.
Yeah,
it's labeled oxytocin because Pitocin's just a name brand.
Yeah,
and so it is mimicking the oxytocin that your body actually produces. So the cool thing about it, though, is that it's a uterine stimulant, so it gets your uterus doing and contracting. However,
that's what oxytocin does in labor, is it stimulates contractions.
However, it is not a cervical ripener. So if you go in for an induction and your cervix is not ripe for it, then you will probably need a cervical ripener before the onset of Pitocin. So any of you that have been induced out there, we'd love to hear your experiences. Yeah. But I just want to quickly talk a little bit about cervical ripeners. There's typically two of them. It's Cytotec and Cervidil, or I can't remember. I get them mixed up all the time.
Because there used to be Misoprostol.
That's the same as Cytotec.
It's just, that's right. That's
brand
the
name.
Same.
Yeah. So you'll hear different names, and there's the Cervidil actually has like a D name, and I can't remember what that one is either. Actually, I wrote it down.
Oh, nice.
It is.
But what a cervical softener does is, no matter what you can have contractions for 5 days, and they can be the hardest, most intense contractions, but it will not do anything if your cervix is hard, thick, and posterior. So it's not.
So the cervical ripener is to get it to efface and dilate and soften and just ripen up for labor. So that way, when they do start, or if they do start Pitocin and it's pushing that baby down on the cervix, then it is actually going to make it so your baby will come out.
Oh, and that's cool. Bethany just said when she was induced, they started with the Cervidil, and that alone got her contractions going. So that's awesome. Cool. And that happens.
And
so
she said she was 40 weeks, 5 days. So like when you're a little bit further on too, typically your body becomes more ripe for it.
Well, because that's what it's supposed to be doing. So if you're too early, your body has a harder time because that's not what it is wanting to do yet. But we're going to talk about that. We're going to talk about medical inductions, like the necessary medical inductions. We're going to talk about not medically necessary medical inductions. But what we really want to do here is this is a no judgment zone. If you had if you used Pitocin or didn't use Pitocin, we really want to just create a safe place for you guys to feel like you can be who you are. What our job is to present to you the options, because when you don't know what the options are, the risks and the benefits of something, when you don't know what to ask, then you really don't have options. And that's our issue with childbirth in general, is when we don't know, we don't have the option, but we want you to know you have so many options, and knowledge is power. So when you know, you can make better choices.
There's a quick question I'm assuming it's Brittany, right? Brittany from Part of the Mess. She says, if you are being induced, can you still say no to Pitocin? Okay, so the question would be, and then she says, do you still have all the say as the patient? So the question is I guess really, if you break it down, is why you're being induced.
Yes.
And so typically, if you are being induced, if they schedule an induction date and you go, it is typically the process of ripening the cervix and then administering the Pitocin. And the Pitocin is administered through the IV, and it's a gradual process. They'll start it low and then gradually turn it up over a few hours. And for each woman, it varies, and that's really just how ripe your body is for labor.
Yeah.
Now, so Pitocin in the hospital setting, it's specifically Pitocin that they're using. So you could say no, but then technically you're not getting induced.
Yeah.
So
and unless it depends on why they're inducing you too, like. If it's a medical necessity. So let's go over that really quick, since that's a good to talk about, is several reasons you would get medically induced is like for gestational diabetes, intrauterine growth restriction, so your baby's not growing. A lot of times if you're past 42 weeks,
which you're not actually late until after 42 weeks.
Yeah,
so
after.
That's technically it.
That is when a lot of doctors though will induce you at 40 weeks. That's not considered medically necessary unless high blood pressure, gestational diabetes, intrauterine growth restriction.
There's placental issues as well. If you have placental issues, like where if the uterus is separating from the placental wall, or if there's any placental issues, those can be definite grounds for induction.
And obviously, if your water breaks, that is if it's been the 24 to 48 hours, then they'll want to induce you for that. As well as amniotic fluid, like low amniotic fluid, infection of the uterus, things like that. Those are the medically necessary reasons
that they would want to induce you. And even then, in some of those instances, you can talk to your doctor. You can figure out a plan together. Like, okay, let's take it one day at a time. I'll come in for non-stress tests.
Yeah.
As long as my baby's doing fine and I'm doing fine, can we just put it off a day at a time? Or if you feel totally comfortable and have checked in with yourself and really feel like...
And you know the risks and the benefits.
Yeah, you know the risks and the benefits, and you feel comfortable with going in with and going through with the induction, then absolutely go through with it.
Yeah. Just so you know, if you feel like when your doctor says, "Oh, you're 40 weeks, let's schedule an induction for 40 weeks because then you'll be post due date." If you do not want to be induced, you can lovingly say, "I'm not overdue at 40 weeks."
But you know what? Here's this is gonna show my my
bias,
my personality here.
Oh.
This is gonna show my personality here. You can go ahead and schedule that induction, but there is no actual induction police. They are not going to come to your house and pick you up and haul you off to the hospital. So they might call you and maybe make you feel uncomfortable, or you might avoid some, I don't know. It's just like that, I'm a ask forgiveness then permission kind of person. I probably shouldn't say that over to the universe, but
hey, you are who you are. I love that.
But just so you know that you can schedule that induction, but if it comes down to the day and you're not feeling it, you do not have to go.
Yeah, you don't. But again, I love what women are saying here. Like, I didn't have to be induced, but I wanted to. That is so great.
Within your right.
Yeah, you can, as long as you're not putting your baby at risk. So as long as it's not before 39 weeks, you
which just
can do
so
what
you
want to
know,
do.
Any unless it's again medically necessary, before 39 weeks can also have the issue of your baby being preterm and having the possibility of them being in the NICU.
So with that being said, my husband works at a hospital, and they have started cracking down on before 39 week or before 40 week inductions across the board at their hospital, because they saw a huge increase in NICU babies needing to be in the NICU. And really that 1 week can make a huge difference for your baby.
And what's cool about it is your baby inside you, 1 day of a baby being inside you is, I think, the equivalent of 3 days outside.
Yeah.
And that's like close to term. The earlier they are, then it's even more. There's more development happening every day earlier in your pregnancy. So just know that like every day that you have your baby in there is not a bad thing.
No,
they're doing lots of growth and development every single day.
And let me tell you, if anyone understands the uncomfortableness of pregnancy at the very end, I got you. I had twins. They were 5'13" and 5'8" by the time they came out, and I thought I literally thought my skin would rip and my vagina would fall and my
uterus would be inside out.
And it would be inside out. So I'm well aware of the discomfort.
And it is uncomfortable. But then you're 10 years...
But if you can remember and that become your mantra is... It's so much better that they're in than they're out. I can deal with a few more days of discomfort. I can deal with a few more to give my child...
And
better.
We have an amazing follower, Brandy. She just had her baby last week, and she was in the hospital for 11 weeks on bed. In the hospital for 11 weeks on bed rest through this
during COVID.
Like she couldn't see her. She's got little kids too, and she couldn't see anyone. And that was because
she
her
kept
water had
saying
broken.
it was worth it to
Keep her baby
in there. So just so you know, we get it, and we know you're gonna want to.
We did
be done.
Have a question about how we know, or how you know how ripe your body is. Wonderful question.
That's such a good question.
And one we love.
And you need to know that.
Yes, and you can know that by the Bishop's score. So if you are unfamiliar with the term, we have a YouTube video like this. It's just one of our lives that we recorded and posted on YouTube that we talk all about the Bishop's score. And it goes through the 5 ways that your cervix is actually changing. And then it gives you the way that you score it. So anytime you have a vaginal exam, you can ask whoever's performing the vaginal exam the different ways that your uterus is, or excuse me, your cervix is changing, and then you can
score yourself or ask them, what's my Bishop's score?
And if you're lower than 6, your body's not right for it. And there's a really good chance that no
induction is going to do anything. But again, if it's medically necessary, then your doctor knows that you're under a 6 and will give you something like Cervidil or Cytotec or something like that. So, but I find it so here's the deal. What we're about to present to you is, it might sound scary, and we are not fearmongers. We do not want to present to you scary information. What we want you to understand is that with anything, when you intervene in birth at all, there's a risk attached, no matter what. Like a sweep of the membranes has a risk to it. A IV can have a risk. Like every intervention has a risk. So what we're about to present to you, we're not trying to make you afraid. And if you had Pitocin and you're fine, it's so good. And most women are fine.
Yeah, it's rare. It's rare, but there are some side effects.
Yeah.
And so just again, want you to do your own research.
Yes.
We're going to provide you with some information, but again,
but our point is always trust yourself.
You do your own research. You figure it out for yourself, and you fill it out for yourself. Because again, what might be right for somebody else is
not right for
you. So it's just you get to choose. That's the best and the beauty of it. And throwing it back to Brittany is that if you don't want to, you don't have to. And if you but then again, even with not having the induction, there are some risks. So again, it's like getting in a car, right? Like you just have to weigh the risks. Like there's a chance I could get in a car accident, but it's a pretty low and it's pretty rare.
Yeah.
And I'm going to be very careful, and I'm going to be very aware, and I'm going to make my own choices of like the route I take and putting on my seatbelt and things like that to make it even more safe. Same with pregnancy, childbirth, and labor.
Yep. So just going over the benefits, we all understand the benefits that if it's medically necessary, you can get your body here through a vaginal birth. Before Pitocin was discovered, or, the synthetic was made, your only option was surgery and to be, being anesthetized and put under and missing the whole experience. So I love that about Pitocin is it bridges a gap between here and there. It gives you a middle ground. And what we do know as doulas, many times, a lot of women have needed to be induced and achieved an unmedicated birth.
Oh yeah.
So and that's
just so you know, if that's a goal that you have, that you want to be unmedicated but are facing an induction, you can still have an unmedicated birth. It's like without an epidural. We've seen it many a time, and it's like
they're historically
more painful.
Yeah, contractions with Pitocin are historically more painful, again, because it is synthetic, and so it's different.
The highest risk of Pitocin is uterine stimulation.
Yeah.
So that just means that your uterus is overstimulated, which makes it tired and fatigued, and then there's the snowball effect of like fetal distress and things like that. So. But which can happen, but it also, the beauty of Pitocin as well is that it can be turned down, it can be turned off, it can you have like the varying
work with your body, and your body responds pretty quickly actually. So that is what's cool about the benefits of Pitocin. Should we talk of some of the side effects?
Yeah.
You want to go into that?
Yeah.
So let's just go into that. Some of the side effects. Well, should we talk about why you wouldn't want to be induced? Like some of the reasons people use inductions and and maybe is unnecessary? Or do we care?
Yeah, I mean, we talked about some of the medical reasons, just barely, but go.
So some of the reasons that your doctor might present to you to be induced, but that you just, our plea to you is, if your doctor is giving you an option for these reasons when it's not necessarily medically necessary, is to do your research and make sure you're okay with the side effect risk of it. Convenience, like you're just done being pregnant,
or your doctor's like, I'm going out of town,
or your doctor's going out of town,
so it's convenient for me to have your baby
at this time. Maybe like you're going out of town, so I mean it might be convenient, but just take into consideration the health of your body and your baby. Going past 40 weeks, you can, so I looked this up. The American College of Obstetrics and Gynecology, which is ACOG, it recommends that inductions should take place between 24 weeks.
No, 42.
Or sorry, 40.
She had a dyslexic moment.
42 and 0 days and 42 6 days. So,
which is an interesting, so
that's 42 over 42 weeks.
Yes, so
is what they recommend.
40 weeks. So this is ACOG. This is the
this is like it, like this
the
is
college.
The college.
Yeah.
Obstetrics and Gynecology.
OBGYN.
Yeah. So just so you know, when you're 40 weeks, you aren't technically overdue. So it
not
takes
until 42.
42 weeks is when you're like
post
overdue, and and most of the time you'll have your baby in that 2 weeks. Also, your baby's getting too big. I think we've said this before, but ultrasounds cannot accurately measure the size of and weight of your baby.
Yes. Did you know that the closer you are to term, they can't actually get the full measurements on the uterus, or on the ultrasound screen. So they so it's just mostly an estimation, and it can be up to 2 pounds off either way, which is a huge swing when you consider how big a baby is.
Yeah.
So
2 pounds, that's a lot.
Which quick story here. I had a girlfriend of mine, she had her third baby, was 11 pounds. She gave birth to him vaginally. Definitely sore and tender, but totally fine, healed, just great, whatever. And then with her fourth baby, her doctor was like, oh, I don't know, it looks like you might be bigger than the last baby. And she was like totally freaking out. And so she decided to get induced, and her baby was less than 7 pounds. So it was just like
a huge
window, a huge difference.
It's hard. It's just hard to know.
And here's the other cool thing, though, is the longer your baby is inside you, the more they have the relaxin hormone in their body.
This is really good information.
They are like bendy. Their fontanelles are bendy.
Yeah.
Their bones, their ligaments, they are bendy.
Even though they're bigger, they actually can slip through just as easily because of that exposure.
They will mold to the space that they are given. So if you are worried about having a big baby, then just maybe wrap your mind around like, oh, I'm going to move a lot more in labor.
Yeah.
Because then I'm going to help my baby get down and swirl their way down and out.
Yeah.
So
just so you know, being measured and told that you have a big baby, we're just letting you know it. Don't let it go to your head, and know that it's not always necessarily. It's not always necessarily true, because they cannot accurately tell you how big your baby is going to be until the baby comes out.
Yes.
That's when you know.
That's when you know for sure how big your baby is.
Yes. So that is all. Those are all the reasons that a doctor would offer an induction that's not medically necessary. But I love that. I think it was somebody said, is it Bethany? Oh, Bethany said, my mom is the only woman I've personally known that went over 42 weeks.
That's
it
awesome.
Never happens. You're hard. Induced by then now.
And I will say, and especially in the hospital setting, it's very rare. Yeah. I am a home birther, and so in that scene, it's a lot more common. I have my midwife wouldn't even consider anything before 42 weeks. So, but throwing this out there, I forgot. I had a thought, but then I forgot what it was.
I don't remember.
Keep going.
We've had
It'll come back.
I'm trying to think. See here. Oh, Ashley had people ask her how much the baby was going to weigh before she had it.
Well.
Oh, so did Brittany. Oh my gosh.
Oh gosh.
Yeah, you can tell people you can't accurately know how much a baby's going to weigh until they come out.
Like, you can guess, and I'll give you a high five if you're close.
That is super, super funny. Okay, so we're going to go into some of the side effects. Again, these are rare, but just besides the fact, the one thing you can count on is that your contractions will be harder, longer, and stronger.
Maybe. Sometimes, honestly.
Okay, for 70% of women.
Okay, there you go.
70% of women have.
Because I've been to a few births that mom had Pitocin, and she was doing just fine. So
I love that.
Which is awesome.
That's so cool.
So great.
So it's possible. It's all possible. Oh, this study said 78% of women complained of longer, again, stronger, and harder.
It's a uterine stimulant, and so typically what happens is there's just either you've got your regular oxytocin and the Pitocin like on top of each other, so it's a higher or more intense, or it's in between and it just feels like it's constant. Yeah. So that's why it can become overstimulating to the uterus. That's why it can become exhausting faster, and that's why it's a little bit harder to be unmedicated when you have Pitocin. Yes. However, not a right all. Like that's It doesn't mean that your goals of being unmedicated, if that's one of your goals, is over just because you are induced and have Pitocin. You can absolutely do it.
So here are some studies I found. If you want. So here are some studies I found. Take with it what you want. Okay? So according to one study, you're 6 times more likely to have a C-section if you do get Pitocin. It just is what we call the cascade of interventions. Like once you start an intervention, it can happen that then your contractions are really hard on top of each other, and then you need an epidural, and then you're too stressed out and you can't, and the baby can't dilate.
It can be a slew of reasons, but even let's take, for example, the overstimulation, the hyperstimulation.
Yeah, that's a problem.
Then you become exhausted, baby becomes exhaused, there's fetal distress, and then you have to rush in to help save the baby. So, and that's just like a very common.
Not only that, but then once you start Pitocin, they want to see you dilate 1 centimeter per hour. And that is sometimes
when
hard.
You hit 4 centimeters.
4 centimeters, yeah.
So it's about a half a centimeter per hour before that. If you're going in like with nothing, and you're the night before with the Cervidil or the Cytotec, and then but once they start Pitocin, they like to see.
So you're kind of on a clock, and if you're not maintaining that clock, then
they typically up it.
They'll take you. So that's one thing to be aware of, is you're on the clock, and it's more likely that you'll end up in a C-section. Some studies have showed that women have longer labors. Women that had unmedicated or not uninduced labors and induced labors. And that was a small study, so don't worry about that.
It makes sense when you consider if you're going in being induced, it's usually because your labor hasn't started. If you're going in already in labor, that means your body is prime. Like prime and ready and ripe for it, and so you are typically
you're clocking longer labor.
Your labor is going to be a lot shorter if you are already in the throes of labor than if you're trying to get it going.
Well, and plus then when you all that early labor stuff that sometimes takes days, where you're having irregular contractions and you're kind of
feeling off and funky.
Weird. All of that gets to happen in your home.
Strong Braxton Hicks and things, or even just feeling some contractions, but they're irregular, and then they pitter off,
and then you rest, and then you
I love when people say that it's false labor, because guess what? It's still doing stuff. It is it's the best. Yeah. Seriously, it's so great. And when I have clients that go and they're like, I'm dilated to a 3 and I haven't even had my baby yet, and I'm like, awesome, that's 3 centimeters that you don't have to do when you're in actual labor. Yeah. So, and all of those pre-labor stuff, all of the Braxton Hicks, everything that is helping your cervix to ripen and change is all stuff that you don't have to do in active labor. So I love it. I get so excited when I have Braxton Hicks and they're strong and they're coming more frequently there towards the end, because I know that I can handle those just fine.
Yeah.
And then it actually makes everything in the go time a lot shorter.
Yep. It scrunches it up. So, yeah, good attitude, April. It's true, though.
Thanks, Britt.
Like, if you can wrap your mind around that early labor, instead of feeling exhausted, use it as a time to rest. And, like, it's like your prep time. Like, oh, things are happening not regularly, but I'm going to take this chance to hydrate, to rest,
and to, like,
to relax.
Practice breathing through my contractions and relaxing through my contractions. And if you take our class, then you know all of the, like, have your partner do the counter pressure techniques and all the things, and you can make it practice runs. So that way when you are in actual labor,
you know exactly what to do.
It's going to go great.
Okay, last thing, the last side effect I want to go over, and this one is the one that sounds really bad, but I just want to tell you that this is in the insert in the Pitocin. So any medication comes with an insert of the side effects. So I just want to tell you what's in the insert. Again, I don't think it happens very often. There's no research. There's no studies that have been done that I could find. But basically in the insert, it says that there could be, to the baby, fetal heart abnormalities, which is like a slow heartbeat, and low APGAR scores. So that's like when the baby is born, they take scores on their color and their receptivity and their reflexes. Thank you. That's what I did. So that is a side effect. A neonatal jaundice, neonatal retinal hemorrhage, permanent central nervous system or brain damage, or fetal death. But again,
no studies, but those are just in the insert.
That's in the insert.
Also, something else that's also in the insert is that, or from the manufacturer, is that it doesn't recommend being used on women who have had major abdominal surgery, which is
because of the stimulation. And
actually, there's one of the side effects of it is that the uterus separating from the placenta, and that typically they've seen that most often in women who have had C-sections, previous C-sections. So if you have had a C-section, you might really want to think long and hard, do a lot of research, really fill it out. If
talk to your care provider, consult with them.
The crazy thing is a lot of care providers actually will say, like, oh, if you want a VBAC, you have to be induced. So really talk to your care provider about that. Say, I've read, like, go and read the insert.
Take him the insert. You can get it online. It's easy to get.
Just say, you know, I saw this. I'm not super comfortable. If that's what you're feeling. If, like, you open the conversation, take the information and say, hey, I see that on the manufacturer's packaging it says, like, this could happen. I want a VBAC and I've had major abdominal surgery. This is a risk. Like, what do you recommend? What's your experience with this? And really open that communication. So
yes. Okay. So exactly what she said. Thank you, Amanda. Is postpartum hemorrhage a side effect? Yes. I skipped over that. She said, I thought that was what my midwife listed as one of the reasons I may have hemorrhaged. And that is true. And it's exactly for the studies show that there is more postpartum hemorrhaging, which is weird because they give you Pitocin to stop hemorrhaging, to stop bleeding. But the reason it happens is exactly what April was talking about. That it is because of that ultra uterine stimulation,
the hyperstimulation.
It will tear it.
It's just so intense on the uterus that it's because your body is already equipped with the hormones to do what it needs to do with its own oxytocin. So think about if you're, like, doing some push-ups or, like, these aren't push-ups. What are these? Bar presses? I don't know. You guys,
chest press.
Let's say you're doing some chest press and you can only pump the bar, but that's like your muscles are well toned for the bar, and you're doing the bar, and somebody packs on 50-pound weights on each side. It's gonna be super tough, and it's gonna tire you out quick. So I mean, you wouldn't go to 100 pounds all at once. So that's the beauty of the Pitocin is that it is like your body can acclimate to it because they start it low and they keep going. If they pumped you full quick, it would be really intense and really difficult on your body. However, it's a slow, gradual process, and typically it's the overstimulation that causes the problems.
Okay, good. And Brittany asked a really good question. If there aren't studies, why do they think this can happen? Okay, so there's a difference between like research, like independent research studies, and the medical insert. So basically, the medical insert is telling you that when they did their
preliminary,
stuff, like to make sure this drug was safe. You know how they do that, like the
test trials.
What's the test trials? Thank you. When they do their test trials, those were some side effects that happened during the test trials. So though,
and it was either like a low enough percentage that they didn't feel like it was going to be I mean, obviously with every medical
they have to say anything that happens.
Yeah, and there are lots of side effects with everything.
Yeah, any medication. So, well, I love whenever I watch TV, like live, whenever there's a drug commercial, it's like 45 minutes of like, and then you could die, and your liver could rupture, and your eyeball could fall out, and your teeth are going to go jagged, and your cheek will fall open.
Honestly, it's
covering them.
It's for the lawsuits. It's just they're covering every basis.
They have to. They have to cover themselves. So usually, what happens is then once the medication comes out, then independent researchers can create studies around that. But I did not find any independent research studies about those specific things that happen to babies. Though I did read of several, actually like a lot. I didn't find any research about it, but a lot of women saying that their babies had jaundice, and they linked it back to the Pitocin.
I will say,
a lot of babies all 4 of mine had jaundice.
You know what? Most babies have jaundice. In fact, most babies have jaundice, and so we should probably do a live on jaundice. Jaundice is very fascinating. It is. It's pretty common. In fact, like very, very common. Mm-hmm. However, like the intensity level of it is sometimes over exaggerated. So again, that's another one, like doing your research and understanding a little bit more about.
We are going to talk about jaundice. It's fascinating.
It's a really cool one.
And there's really cool ways to help
your own baby.
And your own baby. And like all 4 of mine, and I treated it differently every time, and it's just interesting. So we'll talk about that a little bit, jaundice, a little bit later. But those are all the side effects. April is going to talk a little bit about how, if you are in a position where you're using Pitocin, how to make it most effective, right? Are you going to turn that up?
Yeah. I kind of forgot.
Did you do risk and benefit?
Well, I just researched and went down the rabbit hole.
Are we talking about the same thing?
No, it's good. Okay, so how to make Pitocin more user friendly. That's first of all, talk to your care provider. Make sure that is like number one, what you want and you feel comfortable with, that you don't feel like you're being pressured into it. Make sure you feel like number one, you are making the decision.
Yes.
That's incredibly important. And then once you go in, then you can go in relaxed. You guys, your body responds to your emotions, okay? It responds to your thoughts. It responds to what you are feeling. And so if you're going in fear and tension and all of that, then you have to know that is creating tension inside your body. So
with the Pitocin or not the Pitocin,
no matter it doesn't matter. So making the decision, whatever you're comfortable with, then go in feeling confident in that decision, and just like, embrace it. Embrace it. I made this decision, and guess what? I'm going to relax into it. It's going to be great. This is exactly what I feel like I need. And maybe it's not exactly what you feel like you need, but it's like, I made this best option. Yeah, I made this decision, and this is how it's going to go. So go in with that attitude, and then as you are relaxing into it and relaxing through it, make sure you're using breathing techniques. And this, I'm going to specifically talk to unmedicated, and you can interpret this for medicated as you will, but use breathing techniques, use relaxation techniques, put some, like, set the atmosphere in your room, like, make it feel comfortable for you, put music on, bring your favorite blanket, like, and your favorite pillow, like, really get comfortable with it, and move around. Like, just because you have an IV in you does not mean that you are stuck to that bed. So
technology is amazing.
Yeah, you have an IV pull. Sometimes you even just can have a bag. Like, get up if it's So typically if you have a cervix ripener, they want you to come in the night before. They apply it the night, like, so Cervidil, they will last for 12 hours. The Cytotec is less strong and less money, and so they apply it every 4 hours. And so you'll have to decide, again, talk to your care provider if that's a thing. Ask what all of your options are and see what you feel more comfortable with, because if it's coming every 4 hours, that means you're probably not going to get the best sleep of your life. So just understand that. Mm-hmm. Do the best you can to get as much sleep as possible, because once that Pitocin starts and that labor starts, you're going to get tired. And so not having great sleep the night before isn't ideal, but do what you can. I know it's exciting and it's like, okay, we're here, we're going to have a baby soon. But one thing that you need to know is that, and I read this lots of places, and I will say from personal experience of attending women that have been induced, is most parents don't realize how long it actually takes. So they go in thinking like, oh, we're going to get induced, we're going to have a baby in a few hours. But it can be a few days. It can be a few days.
And actually,
it will, a lot of times, it will be like a whole day and then another.
And into the next day.
So just like mentally prepare yourself that it might be 2 days from then still. So, which kind of stinks.
Okay, because as humans, if we can wrap our minds around
then
things,
it's fine.
It's like no big deal.
Then it's fine. And then if your baby comes earlier, you're feeling great about it. So again, just like mentally prepare yourself for that. And then as you can get the amount of sleep that you get, which is great, relax into it, rest, nap as much as you can. And then once the Pitocin starts, then really take the opportunity to work with your body. So walk around, try to get your own oxytocin to kick in.
Because it will.
Because it will. It will. That uterine stimulant, it's like the prostaglandin. Okay, so all of those cervical dilation things, it's just prostaglandin in them. Yeah. So your body, and a lot of the time, the reason why they work is because it's like reminding your body like, oh, we got to do this. Let's soften the cervix and secrete our own prostaglandin to make this happen. Mm-hmm. Same with the Pitocin. Oh, this is what we're supposed to be doing right now. Okay, let's release the oxytocin and we're going to start our own contraction starting. So what's great about that is, again, they'll kick it up, usually two points every, I don't know the technical term for it, but anywhere, they'll start you at about 2
minute.
Oh, there you go. She knows. I just know the number.
Right.
But usually, I think the highest I've seen it go is 12 or 14.
Whoa, that's high.
Yeah.
Whoa.
And so usually it's like 10.
That's even kind of high.
Is like 8 to 10. However, you can ask them to turn it down. Yeah. I will say I never have seen it that high with a woman that's unmedicated. She's always had a epidural.
Oh, got it. Yeah, that makes sense.
However, if you are unmedicated, again, work with your body. Try to get your uterus to kick in, or your body to kick in their own oxytocin. Go on walks. Walk the hospital if you can. Go outside if you can.
Yeah. You have a lot of control in this.
Get in the
even
bath.
If you don't
even
feel
if you
it.
have IV, you still can get in the bath. Like, I know that they have monitors that are actually waterproof now, that are mobile units now.
It's cool.
So there's lots of things that you can do.
It's like a little purse. So they're really fun. I want to respond to Autumn. Autumn says, how do you stay relaxed if just thinking about labor makes you anxious? Anxiety gets the better of me, and new experiences make me uneasy because I don't know what to expect. And Brittany says, same. So here's the thing, you guys. Both of you and anyone else out there that feels a lot of anxiousness just even thinking about labor, not only, and then add on all the decisions that you have to make, that can feel super overwhelming. And we totally get you. And that is this is almost exactly one of the reasons why we made our course, is we know how important it is for women to feel supported and not like they have to go digging for all their own information, because you don't even know the questions to ask. So that's where we come in, is we give you all the information, we present you with options, we guide you through what are your goals. We start there. What are your goals? Once you have goals, then everything else is a little bit easier. All the other decisions.
And don't be afraid of making goals at the beginning of your pregnancy, and then them shifting and changing as you understand or know more, because it does. It really, and your own pregnancy might change. Like just having your 20-week ultrasound, you might decide something different. So
and that's what's cool is you can make all these decisions throughout your pregnancy, but the anxiousness goes away because exactly what you said. When you don't know what to expect, it's really scary. But that's why taking a childbirth education class is so important, because we teach you tools about how to get into relaxation. And if you can go into relaxation, time you kind of lose track of time and space. Distorted. And you are so concentrated on being really like zenned out that there's no room for anxiousness. But if the anxiousness does come in, we give you all the tools how to get yourself out of there. We teach your partner how to support you, because this isn't just you. Like this is an experience for your family. So we just want to let you know that a childbirth education class, whether it's ours or anyone else's.
Let me just give you like out of hospital childbirth education class. Like,
yes. Thank you for saying that.
I recognize that there's a lot of childbirth education classes in the hospital, but I really just think that the best you're gonna get what's anyway. There's some that are really great, but I will say you'll get better information. Or here's the deal. Not even necessarily an out-of-hospital. Just make sure that whatever childbirth education class that you are taking aligns with your goals.
Yes.
Because if you're wanting an unmedicated birth, then an in-hospital class might not be the best option for you. Go with something else. If you're just like, oh yeah, I want
the epidural as soon as possible.
I want the epidural in the parking lot.
Yeah, then that's a good one, because they just tell you about how everything works.
They'll go through the process of things like that. So,
but we love, even if you are planning on a medicated birth, we love an out-of-hospital childbirth education course, because our bodies are so cool, and we're probably a little biased, but birth is awesome, bodies are awesome, and anytime you can learn more about the functionality of your own body is beneficial, even if you're not having babies.
It's true. And I will say, one of my best friends is an in-hospital childbirth educator, and she's amazing. Yeah. She is so cool, and we have some of the best conversations. So I just want to put it out there that there are some fantastic in-hospital childbirth education classes, but just know where you're taking them. So for example, that's at the University of Utah, which has their program is usually more mother friendly anyway.
Yes.
And so they do really, really great there. Yeah. So
and I love what Bethany said. Knowledge is power. I think the more knowledgeable I become, the less anxious I am.
Absolutely.
That is human behavior. We are anxious when we don't understand. So definitely, if you feel any anxiety about any decision, especially regarding birth, just being educated and asking good questions is really good. And then, Miriam, the links on our blog post did not work.
Oh,
thank you for telling me.
Miriam, I got your email. Oh. And I was going to respond, and then it got buried in my email, and I forgot.
And she forgot, but now we know. Okay, I'm going to fix those links. I'll fix those as soon as possible. Because those are important.
Yes,
dang it.
Yes.
Sorry about that. Okay, guys, do you feel better about Pitocin? You got this. If you choose to have it, awesome. If you choose not to have it, awesome. But now the choice is yours.
Yeah, you get to make the choice, and you get to, even if it's a medically necessary situation, you still get to choose, like, okay, I'm going to do it because the risks and benefits, like, this is the decision I'm making. Yep. So just know that the decision is in your hands. You ultimately get to make that decision.
You got this.
Take responsibility
We're so excited.